And what should they be doing?
No, I don't think people should be frightened. I mean, the risk right now, today, currently, is really relatively low for the American public, but that could change because what's going on outside of the United States, particularly obviously in China and in other countries in which there are travel-related cases, that this could evolve, and I think it would be unrealistic to deny that, this could evolve into a global pandemic, which would then have significant implications for us. So although we don't want people to be worried now, I think we need to realize that this could change. So right now, don't worry about it. Be more concerned about influenza, which is going into a second peak for the season, than coronavirus. But keep in mind that the coronavirus situation could change, which is the reason why we're taking it very seriously, because it could be a substantial threat. Right now, we're still in the middle of the flu season, and for flu, you get vaccinated, you wash your hands as frequently as you can, you avoid crowded places where people are sneezing and coughing. That would help protect you against influenza. And if and when, and I hope it's more if rather than when, if we get substantial coronavirus here, those kinds of typical, simple public health measures could help protect you against coronavirus. People wearing masks now is just not relevant. You don't need to be walking around with a mask right now. Masks, quite frankly, are more important for people who are infected to prevent them from infecting someone else.
And hopefully they would get a better mask than the drugstore sells?
Right. The drugstore masks that sell have a lot of loopholes in them that let the virus through.
Okay. So wash your hands repeatedly. You don't need a mask, and just avoid crowded places where everyone's sneezing. Okay.
Precisely.
Was it a mistake to quarantine the people inside the cruise ship?
Well, I don't think we can categorize it as a mistake or not a mistake. The Japanese authorities who did the quarantine on the ship when it was in Yokohama Harbor felt that with the quarantine there would not be spread from person to person. Obviously and unfortunately, that process did not work, and people who were quarantined on the ship were actually getting infected, and there was a substantial amount of infection, which is the reason why, when you got infected, you were taken off the ship and put in a hospital in Japan. But as people continued to get infected, the decision was made to get people off that ship and get them back home in a safe way.
Could you quickly explain the 5 cities and which 5 cities CDC is testing in and why that's so important?
Right. What we're trying to do right now, we know we have 15 cases in the United States, 13 of which are travel, 2 of which are the spouses of travelers. We're not having, to our knowledge, undetected spread within the community. But in order to make sure that we're not having that, what the CDC has done is they picked 5 sentinel cities: New York, Los Angeles, San Francisco, Chicago, and Seattle. And what they're doing is when people come in with symptoms of flu, but who test negative for flu, they're also testing them for coronavirus to see if there are people out there who are having symptoms who really do have coronavirus, even though there's no well-known connection between someone who traveled to Wuhan and came back here, or who is coming from Wuhan. If you get a sampling, you can get a pretty good idea of whether or not we're missing cases. That would be really important, because if we are, then that really changes the complexion of what's going on. We'll know that reasonably soon. They're starting the testing imminently.
And should people be hoping for a vaccine to help solve this problem?
I believe we're going to have a vaccine, because we're going into clinical trial for phase 1 within the next couple of months. It will not be for at least a year or more until we know a vaccine works, even though this is the quickest we've ever done of going from identifying the virus to going into a clinical trial in human. But still, to have a vaccine practically available for people should be well over a year and a half, at least at the earliest. So right now, the countermeasure to stop this is much more classical, simple public health measures: identification, isolation, contact tracing, quarantine where appropriate. Vaccines will be relevant if we go through a cycle where this comes back next year and the year after. That's where vaccines will be important.
And finally, are you getting what you want from the Chinese government?
Well, in the early weeks, we did not get the kind of information that we would have liked to gotten. But right now, it looks like the Chinese government has really realized that they better be transparent, and they're telling their own people to be very open and honest. So I think right now, today, we are getting the information we need. We're having people who will be part of the WHO contingent that will be going to China to have eyes, ears, and boots on the ground. Hopefully, if they're allowed to take a look at what's really going on, we'll get a direct feedback from our own people.
Terrific. Thank you so much for being with us today.
Good to be with you.
For more information, go to USA Today.
Well, with the scare of the coronavirus, many people have been running to the store to buy face masks similar to this one to protect themselves. Now, this mask protects against airborne hazards, and those stores have been running out or even running low on these. But health officials say they don't know if these masks will actually help you. The CDC recommends only people with the coronavirus symptoms wear a mask, not the healthy people trying to prevent themselves from getting sick.
Speaks, of course, and we are committed to answering your questions about the virus. The outbreak has many of you asking, do I need to wear a face mask? The answer, no. The CDC does not recommend the routine use of face masks in the community. Instead, it wants everyone to avoid people who are sick. Avoid touching your eyes or nose and cover your cough or sneeze with a tissue. People who are sick should stay home and not go into crowded public places or visit people.
General mask wearing probably won't help because what's needed is the sophisticated N95 mask, the one in short supply for frontline medical staff.
The N95 mask has adequate filtration for viruses. If you wear a surgical mask, that doesn't provide adequate protection.
The Chicago Medical Society is worried that a call for general mask wearing will reduce social distancing, and soon will be like Spain, where healthcare workers make up an out of proportion 14% of COVID cases. Surgical masks are not that effective either.
If you sneeze, that prevents the droplets from going out at a very small angle, doesn't prevent it from going out the side of your mask.
But the head of the Chinese CDC says America may be making a mistake by not mandating mask usage. And an American researcher says 38 scientific papers back that up.
My concern is that people will feel a false sense of security using a type of mask that may not protect others from their illness.
Masks. Now, I'm in South Carolina right now, and there's not a whole lot of people wearing masks. So I want to ask you specifically, can you define for people what the role of masks is, and why were we told to wait? Why were we told later in the spring to wear them when we initially were told not to?
Okay, that's a good question, and I'm glad that you asked and to give me the opportunity to clarify it. So let's start with your first question. You know, masks are not 100% protective. However, they certainly are better than not wearing a mask, both to prevent you, if you happen to be a person who maybe feels well but has an asymptomatic infection that you don't even know about, to prevent you from infecting someone else. But also, it can protect to a certain degree, not 100%, in protecting you from getting infected from someone who either is breathing or coughing or sneezing or singing or whatever it is in which the droplets or the aerosols go out. So masks work. The important thing is actually physical separation. So physical separation that we talk about all the time is the best way to get a virus not to get to you. But often it's impossible physically, logistically, to be physically separated to the right extent from everyone. And that's the reason why we combine physical separation with a mask, even though a mask is not 100% protective, but it does give you some protection. So you shouldn't discount that. Now, getting back to your first question, which was what about a month or so, or 2 or 3 ago, when people were saying you don't really need to wear a mask? Well, the reason for that is that we were concerned, the public health community, and many people were saying this, were concerned that it was at a time when personal protective equipment, including the N95 masks and the surgical masks, were in very short supply. And we wanted to make sure that the people, namely the healthcare workers, who were brave enough to put themselves in harm's way to take care of people who you know were infected with the coronavirus and the danger of them getting infected, we did not want them to be without the equipment that they needed.
So there was not enthusiasm about going out and everybody buying a mask or getting a mask. We were afraid that that would deter away from the people who really needed it. Now we have masks. We know that you don't need an N95 if you're a person, ordinary person in the street. We also know that simple cloth coverings that many people have can work as well as a mask in many cases. So right now, unequivocally,
Dr. Fauci, do protests increase the spread of the virus?
do protests increase the spread of the virus? I think I can make a general statement.
Well, 500,000 protesters on June 6th alone.
Yeah.
I'm just asking that number of people, does it increase the spread of the virus?
Crowding together, particularly when you're not wearing a mask, contributes to the spread of the virus.
Should we limit the protesting?
I'm not sure what you mean. How do we say limit the protesting?
Should government limit the protesting?
I don't think that's relevant to.
Well, you just said if it increases the spread of the virus. I'm just asking, should we limit it?
Well, I'm not in a position to determine what the government can do in a forceful way.
Well, you make all kinds of recommendations. You made comments on dating, on baseball, on everything you can imagine. I'm just asking you, just said that protests increase the spread. I'm just asking you, should we try to limit the protests?
No, I think I would leave that to people who have more of a position to do that. I can tell you.
Government stopping people from going to church, Dr. Fauci.
Yeah.
Last week in the Calvary Chapel case, 5 liberals on the Supreme Court said it was okay for Nevada to limit church services. Justice Gorsuch said it best. He said, there's no world in which the Constitution permits Nevada to favor Caesar's Palace over Calvary Chapel. I'm just asking, is there a world where the Constitution says you can favor one First Amendment liberty, protesting, over another, practicing your faith?
I'm not favoring anybody over anybody. I'm just making a statement that's a broad statement that avoid crowds of any type, no matter where you are, because that leads to the acquisition and transmission. And I don't judge one crowd versus another crowd. When you're in a crowd, particularly if you're not wearing a mask, that induces the spread.
It's a simple question, doctor. Should we limit the protests? Government is obviously limiting people going to church. And look, there's been no violence that I can see at church. I haven't seen people during a church service go out and harm police officers or burn buildings. But we know that, for 63 days, 9 weeks, it's been happening in Portland.
Right. Yeah.
Well, one night in Chicago, 49 officers were injured, but no limit to protests. But boy, you can't go to church on Sunday.
What was the? I don't know how many times I can answer that. I'm not going to opine on limiting anything. I'm just going to tell you.
You've opined on a lot of things, Dr. Fauci.
Yeah, but I've never.
This is something that directly impacts the spread of the virus, and I'm asking your position on the protest.
Yeah, I'm not going to opine on limiting anything. I'm telling you what it is, the danger. And you can make your own conclusion about that. You should stay away from crowds, no matter where the crowds are.
Government has stopped people from going to work. In fact, just in New Jersey 4 days ago, Ian Smith, Frank Trombetta were arrested for trying to operate their business, their gym. They were arrested. But my bet is, if these two individuals who own this gym were outside just in front of their gym, and all the people who were working out in their gym were outside protesting, they'd been just fine. But because they were in the gym working out, actually running their business, they got arrested. You think that's okay?
I'm not going to opine on who gets arrested and who does not. You get where I'm going. I'm telling you, as a public health official, I say crowds.
Do you see the inconsistency, though, Dr. Fauci?
There's no inconsistency, Congressman.
So you're allowed to protest, millions of people on one day in crowds yelling, screaming, but you try to run your business, you get arrested? And if you stood right outside of that same business and protested, you wouldn't get arrested? You don't see an inconsistency there?
I don't understand what you're asking me as a public health official to opine on who should get arrested or not. That's not my position. You could ask it as much as you want.
You've advocated for certain businesses. You've advocated for certain businesses to be shut down. I'm just asking you on your position on the protest. I haven't seen one. We've heard a lot about hair salons. I haven't seen one hairstylist who, between haircuts, goes out and attacks police or sets something on fire. But we've seen all kinds of that stuff during protests, and we know the protest actually increased the spread of the virus. You've said that.
I said crowds. I didn't say specifically. I didn't say protests do anything.
So the protests don't increase the spread of the virus?
I didn't say that. You're putting words in my mouth.
No, I just want an answer to the question. Do the protests increase the spread of the virus?
I don't have any scientific evidence that anything. I can tell you that crowds are known, particularly when you don't have a mask, to increase the acquisition and transmission. No matter what the crowd is.
So you don't have a position on whether the protests increase the spread of the virus or don't increase the spread of the virus?
I'm saying that crowds, wherever the crowds are, can give you an increased probability that there's going to be acquisition and transmission.
But do you understand Americans' concern? Protesting, particularly according to the Democrats, is just fine, but you can't go to work, you can't go to school, you can't go to church. There's limits placed on all three of those fundamental activities, First Amendment activities, but protesting is just fine.
You know,
the